Hi everyone, my name is Peace. We are here to discuss about branded and unbranded drugs. What are hospitals under the scheme expected to provide? Join us in this conversation.
I am Dr. Akpiki Kesie, a focal person for the Basic Healthcare Provision Fund under the NHI SSHI Gateway Medical Services Standards and Quality Assurance Department.
What makes a drug branded or generic?
When we say a medication is branded or generic, basically the active ingredients in this are the same. The inactive ingredient may differ, but the differences are purely in terms of the name. That's one. So you have branded medications whose names are different from the generic. Secondly, amount of research that goes into it. So you have a branded drug that a pharmaceutical company must have put in a lot to do their research before it comes out. So with all of that, and again, that affects the pricing. So the branded drugs are more expensive than the generic drugs. Every other thing is the same. Dosage, site of action, route of administration, bioavailability, every other thing is essentially the same. Their packaging is also a bit different from the generic drugs, or what they look like. Color, name, a bit different.
Are there checks to make sure generic drugs meet the standards of their branded counterparts?
Oh yes, before drugs are put out, the regulatory agencies, maybe in the US they have FDA, in the UK there might be the regulatory agencies in all these countries. They have a way of regulating and making sure that the branded drugs and the generic drugs, their efficacy, their pharmacology is most likely at par. So if you have a branded drug that gives a viability of 85 to 90%, it's expected that the generic drug should be around that time as well. So before these drugs are put out into the market, the respective regulatory agencies for those countries, even here in Nigeria, NAFDAC, they usually do that. So our pharmaceutical agencies or pharmaceutical companies in Nigeria pass through those tests as well.
What should participants in BHIS expect from drugs issued to them in the hospital?
Expect that any healthcare provider accredited by the Bielsa Health Insurance Scheme that has accreditation from us, has an MOU with the BHIS, should provide good generic or branded drugs to our enrollees.
What is BHIS doing to ensure enrollees actually receive high quality drugs and services in their facility of choice?
For any facility to have gotten accreditation and has been signed or signed an MOU to be part of the Bielsa Health Insurance Scheme, you must have met all these requirements. Now, one key area is the pharmacy. So there must be a pharmacist, and then the pharmacy must be standard with proper storage facilities and all of that. So we always do what we call a continuous utilization and monitoring. Continuous utilization and monitoring is done to ensure that accredited facilities are adhering to the guidelines of the Bielsa Health Insurance Scheme. We also go out for quality assurance, do quality assurance visits, and then there's a 2-yearly re-accreditation exercise that is done to also reevaluate the initial facilities and equipment that were on ground when these facilities were accredited or granted accreditation ab initio. So all these are done to see that the best of care is given to our enrollees. Every BHIS accredited facility will provide quality medications, whether Like I said, we don't even have branded medications in our tariff. So every drug that is given to them is of good quality, good efficiency, and are good enough to take care of whatever disease conditions or ailments that they've gone to the hospital for. On our own part, will continue with our quality, continuous utilization and monitoring, quality assurance, reaccreditation, and everything we can do to ensure that the healthcare providers give the best of medications to our enrollees. We also have our toll-free numbers in every facility. So if enrollees notice anything that is unusual, they are free to call our numbers and give us any complaints or feedbacks. We can take it up from there. Thank you.